So this is the type of stuff we do at Medulla. So we are a global company. We're headquartered in Cambridge, right next to Shaw's. It's not that you can't miss us, it's just that you don't really, we eat lunch at Shaw's every day. That's what it is. We have offices in not only Cambridge, but in Trinidad and Tobago, and in Mendoza, Argentina. We are going to be hiring at least 50 people this year. And here you can see some of the people who are desirable to look at during the course of the day when you work at Medulla, and some of the people who may be less desirable to look at during the course of the day at Medulla. And two of my colleagues are here tonight. You'll see Charlene McDonald in the back and Sean Hoylett, who comes via our office in Trinidad. We were the number 11 fastest growing small business in Massachusetts last year, and we're going to be increasing that growth twofold this year. So a little bit about what we do and who our clients are. So we've been around, so we were founded in 2004. A lot of us hail from the consulting industry and have a blend of healthcare in our background. Is anybody here interested in consulting? Excellent, excellent, excellent. This was a great crowd you put together here, Mike. So we focus largely in three areas: technology, creative design, and program management. So a lot of what we do for our clients is to come in and say, we're going to solve very hard problems that you can't solve. I can walk into some very large health insurers in the United States, and I can talk to their CTOs about their big data strategy, and they won't have one. Remember, $800 billion of value to be created, and these guys don't have a big data strategy. So we've been dealing with products that we build in wellness management, care delivery, helping providers, helping patients. We focus a lot on consumer empowerment. It's really our vision that technology is really the key to take the healthcare industry and make it such that it's something where you go to your doctor to where your doctor goes to you. The changing costs in the healthcare industry is about making sure that all of us are more educated about the decisions we make and what effect it has on our health and what effect in terms of the value we're getting from the system. A big thing that we've done and that I've piloted and doing is a lot of our software development does take on agile process. This is something that's been very important, particularly currently in the world of the startup we work in today. A lot of our clients, even the big ones, are very much looking for lean, agile approaches to developing new product and getting it to market and seeing if it fails or it doesn't. Some of our clients you can see up here. WebMD was one of our largest clients for some time. Our big clients right now are Blue Cross Blue Shield Association, Optum Health, Aetna, Verizon. You'd be surprised at the types of companies that are getting into the healthcare space today. We have built a platform for Aetna called CarePass. You may have heard of it, although I'm not guaranteed as such. Has anybody heard of Aetna's CarePass platform? So this is Aetna's initiative to part and part change their brand, and part and part, as what their CEO Mark Bertolini said, turn themselves into a health IT company, which is interesting coming from an insurer. But Cigna is also doing the same thing, and oddly, the people who are competing with Aetna and Cigna in this space are AT&T, who has an mHealth platform, which are all APIs, and Qualcomm, who believes that through their APIs, they can then distribute devices that are connected to those APIs that can collect information. So what these people are thinking right now is they're thinking that they can go out and they can source this data. And again, the question is, what are they going to do with it? Their big data strategy right now is about collection, and the next question will be, how can they answer questions about it? And the key thing about what we come in and we help them do is find the right questions to ask of their data, and then help them deploy technology that's going to allow them to scale it and make it so that that answer can exist at petabyte scale. So why would you come to work at Medulla? We're a very open environment. We're a very collaborative environment. We are not necessarily a suit and tie consultancy, although this is as dressed as I typically ever get. But if you coming to Medulla, it's really about accelerating career growth. I was talking to Mark over dinner. And I was talking about what the typical trajectory for someone who comes in as an associate in a consultancy is over 5 years. And really, your growth should double, right? You're going to have the opportunity to not only work with these amazing clients who have very, very difficult problems to solve, but you're going to be working with technologies and tools that are going to really stretch you and really give you a challenge that will allow you to master a craft and really apply an art to what it is that you'd like to do. And I hope that everybody who's here tonight, who's in the IT business today or is in a position where they want to get into the IT industry, is excited about the types of technologies, the types of problems that everybody's looking to solve. Part of that really involves around career management, training, teaching, coaching. We bring on a lot of people either in the US office or in the Trinidad office who are right out of school. They're not going to know big data right out of the way, and they're not going to know delivery right out of the gate. And that's where our years of experience, we're trying to help people and train them into how can they become technology leaders, business leaders, and thought leaders as part of an innovation engine that we're building. Does anybody know what size healthcare is as part of the overall US GDP? 16%. It's 25%. That's $2.7 trillion. Okay? So, does everybody know how much the standard enterprise spends on IT every year? On average. It's about 5%. Okay. Healthcare spends 1%. It's the most underinvested IT sector since finance back in the late 90s. So, doing the math, you spend 1 point of $2.7 trillion on IT, and you should be spending 3. What's the opportunity for healthcare and IT? It's a very, 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 very large number. This is the most monumental opportunity of our time that's going to change an industry and change how the economics of the country work. And that's where we're trying to position ourselves at the center of. Can we be the catalyst for innovation in IT, in healthcare, being the biggest market that anybody has seen since the Industrial Revolution?